Welcome to The Explainer. Nigeria is up against a health crisis that's costing billions of dollars. But what if the solution was already in the palm of millions of people's hands? Today, we're breaking down how digital technology might just be the lifeline this nation needs. Okay, let's start with a number that really just tells the whole story. 20 times. That is the insane increase in the cost of chronic diseases in Nigeria in just one decade. We're talking $8 billion. Now, that's not just a statistic, it's a crushing weight on the entire country's economy.
So to really get why a digital solution is so critical, we've got to first wrap our heads around the sheer scale of the problem Nigeria is facing.
Take diabetes, for example. We're looking at over 8 million Nigerian adults affected. That's a jump of more than 21% in just a few years. But here's the part that really gets me. More than half of those cases are undiagnosed. Just think about that. Millions of people are walking around with a serious illness and have absolutely no idea.
And you see a really similar and frankly scary story with hypertension. Look at this chart. This big section shows that, about 60% of people know they have it. But then the number getting treatment drops by almost half. And then, look at this tiny little slice. Only 12% actually have their condition under control. That's a massive, massive gap between knowing you have a problem and actually being able to manage it.
So why? What's driving these huge gaps in care? Well, a huge piece of the puzzle is this great divide. You've got literally half of Nigeria's population living in rural areas, but they are served by only 12% of the country's doctors. Millions of people are just left dangerously underserved.
But right in the middle of all these massive challenges, a really powerful new set of tools is starting to emerge. And this right here is where digital health comes into the picture.
And we're not just talking about one thing, it's a whole toolkit. You've got telemedicine, which can connect a patient in a remote village to a doctor in a big city. Simple text message programs are helping with maternal health. And there are even things like secure electronic health records that, and this is a total game changer, are designed to work offline without an internet connection. And let me be clear, this isn't just a few scattered pilot projects. There's real national policy momentum here. A national digital health strategy kicked off in 2021, a Serious Data Protection Act was passed in 2023, and a bill to formalize all of this is expected to pass in 2025. The foundation is really being built brick by brick.
Okay, but a strategy on paper is one thing, right? Actually making it work across a huge, diverse nation of over 200 million people, well, that's a whole other story. Let's take a look at the reality on the ground.
The single biggest hurdle, no question, is the digital divide. Just look at this. Internet access in the cities is more than double what it is out in the rural areas. So the question is, how can you